The NetCards project brings together public health players in 16 European countries. It is financed jointly by the European Commission and the partners in the project. The purpose of the NetCards project is to give European citizens traveling around Europe easier access to medically necessary health care, with the exception of planned treatment. For national health organizations, the NetCards project helps to control expenditure and limit the risk and error or fraud by tracking international flows, streamline direct payments by health insurers to medical establishments and practitioners, and lastly, to supply national or regional health data systems with a flow of data on the acceptance for payment or reimbursement of cross-border medical costs. The equipment deployed at NetCards points of delivery is able to read the administrative data from each country's national health smart card, or in the case of the European Health Insurance Card, automatically acquire the data from it. It can check the card's validity online and print out an electronic form for the acceptance or reimbursement of medical expenses. Upon admission to the hospital, patients are asked to show their European Health Insurance Card or National Health Smart Card in order to validate their entitlement to treatment. The data needed to accept the patient's expenses is scanned or captured electronically, depending on the card, so that it can be checked and filled in if necessary online. The NetCards project enables hospitals and practitioners to process patients' administrative data more productively and gives them the guarantee of payment if the cost of treatment is borne by an insurer. As a health insurance manager, I believe that this genuinely trans-European online service will help substantially to limit the financial risks due to human error, fraud, and corruption. The first phase of the project proved that partners in Germany, Austria, Greece and France were able to work together and share common health smart card reading device. This common reader underwent successful field trials during the Athens Olympics in 2004. With the EU enlargement in 2004, the consortium expanded to contain 20 partners in 10 European member states. In addition to the Austrian, German and French cards, the common reader could now read other smart cards, that of Slovenia and various regions of Italy. This phase of the project served to evolve the NetCards system into an online service infrastructure while preserving the gains acquired in the previous phase. As it happened, several European countries involved in the project chose to issue health cards without electronic chips. Now, with the web-based version, operators can download card reading software directly, and above all, they can check the card's validity directly from the workstation at the place of admission, and thereby confirm that the patient is entitled to treatment and that the healthcare provider will be paid. Following this validation phase of the NetCards system, over 80 pilot sites were set up around Europe, including 30 in Germany, to coincide with the FIFA World Cup. In 2007, the consortium expanded again to contain 27 partners from 16 European countries. At the same time, NetCards is rolling out scanning solutions, optical recognition systems for processing the information printed on European health insurance cards. Between now and 2010, every patient traveling in Europe outside their own country of residence with a valid European health card or national health smart card will have easy access to health treatment at any one of the 600 NetCards points of service. When the NetCard system is widely deployed, healthcare establishments and practitioners will enjoy the advantages of guaranteed payment by insurers if that is the case, speedier processing of patients' health treatment entitlement formalities, and much less risk of error and fraud. At the same time, better tracking of patient flows will give European countries more control over their healthcare budgets. The cards, readers, and communication software will be manufactured according to European standards, enabling different national systems to work together. The NetCards project is coordinated by Sesam Vital, an operator of exchange infrastructures in the healthcare field. Today, NetCards is preparing the deployment of an online services infrastructure to facilitate the mobility of European citizens tomorrow.